Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of medical experience. And today I'm going to talk to you about the glucose tolerance test, or the diabetes screen of pregnancy. And generally speaking, we do this around 28 weeks. It's actually 24 to 28 weeks. These guidelines can change a bit. However, overall, the purpose is to screen you for diabetes of pregnancy. So, what's diabetes of pregnancy? Well, it's when you have inability to control your blood sugars as well. Too high is the issue, and that can cause issues with the baby. They can grow a little bit too large. It can increase your risk of a C-section, cesarean section. Can increase your risk of the baby being too large and getting a birth injury like shoulder dystocia. That's where the shoulder is too big and can get an injury. Something called an Erb's palsy that will make the arm have potentially some permanent nerve damage. Thankfully, those risks are very low, and again, that's the purpose of screening, so we can diminish those risks. A little higher risks of infections. If you do end up with diabetes of pregnancy, it might be controlled with your diet, with some exercise, which is certainly going to help, but you might also need some medicines. Right now, the first-line medicine is insulin, but there are other medicines that are alternatives that you might get, something called metformin. Again, those are things that you'll need to talk about with your physician. There is a little higher chance if you've had it before. There's a higher chance if you're overweight or if diabetes runs in your family. Also, if you do end up getting with diabetes of pregnancy, then you do have a pretty decent chance during the rest of your life of getting diabetes, perhaps a 50% risk. And it will all depend on whether you exercise and keep your weight in control, or whether you let those get the best of you. So let's talk about the test itself. Every office has different guidelines with slight variations, so be sure you talk to your doctor about it. But generally speaking, we recommend that you fast for 2 hours before you have the test. As soon as you get ready for the test, you'll be given a glucose drink that has 50 grams of glucose in it. You drink that drink, you wait an hour, and then you get your blood drawn. Often you'll get other blood tests at that time, maybe a CBC to see whether or not you're anemic. You may also get a RPR test, which is a screen for syphilis, and you may also be offered a whooping cough vaccine. Those are all things that are generally done around 28 weeks. Again, speak with your office to find out for sure. So only 2 hours of fasting, but probably would need a Reese's peanut butter cup 2 hours before, even though they're great. They're probably not ideal for that. Now, if you don't pass the test, you'll get a longer test called the 3-hour glucose tolerance test. And that one you need to fast overnight, and there'll be a fasting, and then for 3 hours every hour, a blood test. So it's a bigger one. So you want to be sure to study hard for your first test so you don't have to take the second. And that just means eating right, your fruits and vegetables, exercising. But even if you do all those things correctly, you may still get it for family background, family history, genetics, just something about you. That's why we screen almost everyone. I hope this has been useful information for you, and we look forward to your feedback. Thank you.